For the last 3 or 4 years, Microsoft's really developed a focus on how do we connect services to consumers in government. And if you look at the market, the government market, we're talking about 40% of all spending in states, for instance, that focus on consumers from healthcare to mental health to children's services. And the IT strategy historically was to do that in a disconnected way through disconnected agencies. So for the last few years, we've really begun to focus on where's the market going to be, and how do you help consumers to access services, and how do you help agencies to measure outcomes and deliver services so that you're doing it in a connected way rather than repetitively and disconnected. And we really think that we've gotten ahead of the market because, frankly, now the rest of the healthcare marketplace is moving in the same direction. Well, one of the things we did is we began to really look at how money was being spent in the country. And so we developed a Connected Health and Human Services framework. And it really developed an architectural and a business strategy to help customers, whether it's a large state agency or a county or a small consumer program, to help them develop a roadmap to connect their systems. And for instance, the federal government's MITA architecture, which is the Medicaid Information Technology Architecture, our connected framework mirrors that. And as a result of that, we've begun to communicate with customers at national forums. We've helped sponsor an annual think tank at Yale University. And we've begun to really impact the market in terms of how you can do things from a legacy modernization rather than a giant replacement of a system, to how do you develop things like common client index across multiple agencies so you know which consumers are served by multiple agencies. And we've really begun to shape the market with our customers in terms of how you can begin to better coordinate services. In addition to that, we created about a year ago a partner alliance strategy, and we've got about 30 partners in the country that are working on different components of that framework. So we've been able to scale through our partners and really also scale through the messaging coming out of our customers. Well, a couple things have happened there. I think we really hit it on the mark 2 years ago when we gauged where the market was going to go in health and human services, because we knew the government didn't have the money to keep building disconnected systems between health and mental health or health and children's services. And we were focused so directly on consumer approach, consumer choice, and consumer-centered approaches. At the same time, Microsoft, in its health division and its health solutions group, for instance, were building solutions and a strategy to impact the whole marketplace, both commercial and government marketplace, with consumer-centered health products. Now, as a result of both decline in the economy and the focus in Washington on connecting healthcare, we're actually merging our approaches between our commercial health market and our public sector health and human service market. And we're going to really build off and pivot so that we're leveraging our public sector and our commercial consumers and our partners and really just drive this wide open into the future.